Hello, welcome to today's section. We are going to talk about the study variables. So the first question is, what is the variables? Variables are qualities, properties, or characteristics of persons, things, or situations that change or vary in a study. So we call the variables, it's kind of, qualities, properties, or characteristics. And for the variables, it should be concrete and directly measurable in practice. And usually, such as the variable in the nursing research, for example, heart rate, hemoglobin value, tidal volume of the lung, they are all concrete and can be directly measurable in practice. But sometimes this variable can be more abstract and indirectly observable in the real world. So you need to think about how to measure it. For example, anxiety, coping, pain, they are all very abstract. So how to measure it? Usually, we may measure by a combination of measurements. For example, if we want to, measure the anxiety, how you can tell if the patient is with anxiety. So you may observe if the patient is sweating, and how about the verbalization and the verbalized style, and how about the movements. So from these things, you can tell if the patient got anxiety. Or maybe you can use the scale to measure. Use this scale, state and trait anxiety scale, to measure the level of anxiety. So for this variable anxiety, we can use the reported anxiety as the definition, operational definition, and we can use the perceived level of anxiety as the name of a variable. And this is another name of the variable, but they are all related to anxiety. So you need to make sure which one you want to use. And when we talk about the variables, usually there are several types of variables. We call independent variable and dependent variables. We also maybe call some variable as research variable or concepts, or maybe call extraneous variables, or we may call demographic variables and moderator and mediator variables. So this kind of names of the variables, you need to understand what's the meaning of these kind of types of variables. So first, let's talk about something on independent and dependent variables. So what's the independent variable? Independent variable is an intervention or treatment manipulated by the researcher to create an effect on the dependent variable. So in nursing research, sometimes we want to test if one intervention or treatment is much better than the old one. So this kind of independent variable. And for the dependent variable is the outcome of the researcher wants to predict or explain. So remember, the outcome is the dependent variable. But we cannot call all the variables as independent or dependent. It should be in some special study design. I will talk it later. So dependent variable and independent variable, they have some relationships, and changes measured in the dependent variable are presumed to be caused by the independent variable. So this is a relationship between independent variable and the dependent variable. And usually, for the basis, when we formulating the hypothesis for predictive correlational quasi-experimental and experimental studies, we do need to figure out what is the independent variable in my study and what is the dependent variable in my study. So usually when you study design is the quasi-experimental study design or experimental study design, or you may have the predictive correlational research design. So in this kind of research design, you need to figure out, you need to make sure what's the independent variables and what's the dependent variables. So I will give you an example, a very simple example. So in my research area, we are going to, train the elders for their cognitive function. So we use the computer-based cognitive training treatment, cognitive training intervention, and to look at if this kind of training can increase or maintain the elders' cognitive function. So in this research, in this study, and the independent variable is cognitive training. This is the treatment. This is the nursing intervention. And then they look at if this treatment and intervention can, cause the change on cognitive function. Cognitive function is the dependent variable. So you can simply differentiate what's the independent variable and dependent variable. So you presume the change of dependent variable is based on the independent variable. Because we trained the elders with cognitive, computer-based cognitive training, so their cognitive function has changed. Then we talk about some research variables or concepts. Besides the independent variable and dependent variables, in some other types of research design, we do not call them independent or dependent variables. We call them research variables. So they are also, the qualities, properties, or characteristics identified in the research purpose and objectives, or questions that measured in a study. So all these concepts or variables is the purpose of the study is to measure these concepts and the variables as they exist in a nature setting and without the implementation of treatment. So without any implementation of nursing intervention, you just want to look at, to describe, to explore what's the properties, what the characteristics of these concepts. So we call these research variable concepts. For example, in some qualitative study, we have this kind of research variable or concepts, or in some quantitative studies, such as descriptive quantitative studies. For example, there is a qualitative study, the researcher wants to explore what is the health-seeking challenges among homeless youths. So this concept, health-seeking challenges, is the research variable in the study. And for some researchers, they want to explore what's the stigma of caregivers on dementia. They are going to use the scale to measure the stigma of caregivers on dementia. So the stigma is the research variable, research concept in this kind of research design. And another variable I really want to mention about is the confounding variable. Sometimes we call confounding variables. And the formal name is extraneous variables. So for these variables, they exist in all studies, So if you do study, if you do research, you will have extraneous variables. And these variables will affect different phases of the study. For example, they may affect the participants' selection, or they may affect the implementation of study intervention, or maybe affect choosing the measurement of study variables, or maybe affect how you implement your study protocol. So because it's the confounding variable, and it can hidden the interpretation of findings, so the researcher do need to pay more attention to recognize these variables and then try your best to control. Otherwise, your findings will be not that as true as possible. So just remember this, and I will talk this one later in the research design. And so I will give example about the study we mentioned before for the cognitive training for elders, and we look at the cognitive function. this is an independent variable, this is a dependent variable. So what are those confounding variables or extraneous variables? So we learn the sleep quality of others. If they do some exercise, and do they do some other types of cognitive training, such as they use some, filling the words games, or maybe they sing a song, or maybe they try to memorize some point. So all this kind of cognitive training may influence cognitive function, or the sleep quality exercise, all this kind of thing may influence the cognitive function. So all these variables we should consider as extraneous variables. So as a researcher, you need to control all these extraneous variables. Otherwise, when you get the result, cognitive function has been increased, you cannot make the decision. You cannot say cognitive training is really helpful to increase the cognitive function, because there are so many other confounding variables existed here, so it will influence the interpretation. So that's why we still want to control. We really want to control all these confounding variables. So except these independent and dependent variable and the research variable concepts or extraneous variables, we do have other types of variables, such as demographic variables. And when we investigate the subjects, we may ask them gender, age, ethnicity, educational background. It depends on your research interest. But all these variables are demographic variables. And also, there are some other complicated variables, such as moderator and mediator variables. In this course, I'm not going to talk more about these two variables, but I already gave you some articles you can read. And if you are very interested in, there's many materials and resources you can learn to understand what's the moderator and the mediator. And from my conceptual framework, I just gave a very simple clue. This is the mediator, means this variable mediate the caregiving stressors and caregiving outcomes relationship between these two variables. So caregiving appraisal mediated the relationship between caregiving stressors and caregiving outcomes. And coping style also mediate the caregiving stressors and the caregiving outcomes, their relationships. And contextual factors such as social support, perceived social support, might work as a moderator, to adjust the relationship between these concepts. So types of variables, I just talk something about this kind of types of variables from independent and dependent, from research variables or concepts, from the extraneous variables and demographic variables and the moderator and the mediator variables. So you can figure out what's the variables in your own study, and you can list on the discussion board. I'm looking forward to discuss with you about that. So thank you for today. Thank you.